Hello guys, welcome back to the channel. In this video we're going to be discussing about choosing where to give birth. Now this is the second part of the three-part series videos that I'm making regarding choosing where to give birth. The first one was regarding choosing to deliver or to give birth in your home, which is a home birth, and in this video we're going to be discussing choosing to give birth in a birth center. So if you haven't already seen the first one, I would suggest you go and watch that first to just also see what that was about and to help you decide on where to give birth. I also gave a website address in that video which will help you to research and to give you more knowledge about how you can choose where to give birth and your options. Okay, so let's get back into the video. So my name is Gifty. I'm a midwife based in the UK. I share contents regarding anything in birth, delivery, labor, newborn, new mum, and anything that will help with your journey as becoming a mother. So there's two different types of birth centers. You can have either a standalone birth center or a co-located birth center. A standalone birth center meaning it's on its own, it's not attached to any hospital, and if you were there and needing any interventions or doctor's input in your care, you will be sent over to a delivery suite in another hospital via an ambulance. So these are the standalone birth centers. The co-located birth centers are the birth centers which you can find within the hospital, usually quite close to the delivery suite, and it's an easy access into the delivery suite for any women that needs any doctor's care or doctor's interventions. So for women choosing to deliver on a birth center, you will need to be risk assessed. You need to be low risk, again, and suitable for birth center. So for the purpose of this video, we're going to discuss about the co-located birth centers. So these are the birth centers that are attached to a delivery suite, or either on the same floor or on a floor lower or a floor above the delivery suite. So in order for you to be admitted to these wards, you need to be risk assessed. You need to be low risk with no issues, no concerns. There are some leeway into different things that you can go to a co-located birth center with. So for example, let's say you had a group B strep. You will need to be given some medication during your labor, at least 6 hours before you deliver. So you can still go to a co-located birth center because you can have your antibiotics on a delivery suite, and then once that's completed, you can now be transferred to the birth center to carry on with your labor and delivery. So that's one example of how you can be having some sort of an issue and still be able to go to the birth center. But of course, you will have to be individually assessed. So speak to your care provider and let them check and let you know if you are suitable for a birth center birth. And the pros for delivering in a birth center are similar to the ones when you deliver at home. Again, you have your privacy, you have your midwife with you, and hopefully you will have a midwife that will be with you throughout the whole shift, and not go, or the shift may not change over before you deliver. There's always 12-hour shift rotation for the midwives, so you're more likely to have a delivery with the same midwife. The other benefit of staying in the birth center is that you have access to the delivery suite if you need it without too much of a hustle, because you're quite close to it, unlike the home birth where you need to be taken in via an ambulance. The other benefit is that you are able to do things that you enjoy. You can bring in music to play. You can really just make it your own home. Bring in things that will help you to feel more comfortable, feel at home, and feel more supported and relaxed. Okay. The other benefit is that because you're not on a delivery suite and you're in a birth center, it's a much nicer, much quieter environment. You're more likely to have lovely settings in terms of having a dimmed lights, having really soothing music going, and all of the rest of it, just to help keep you calm and relaxed. You also have the benefit of a pool that you don't need to buy or need to worry about clearing it away or anything like that. So you have a pool if you wanted to use it for birth, or if you just wanted it to use it as a pain relief method. You will also have endless supply of gas and air. Unlike a home birth where they will bring in gas in their cylinders, and sometimes you may have an issue whether it's run out or you need more and it's not there and you have to wait for another midwife to bring you one. But in this case, with the birth center, you have endless supply of the gas and air. You will also have access to all the opiate injections and opiate pain relief that you are likely to get on the delivery suite as well. So it's quite comfortable in that sense. You get a bit of both worlds. So you have access close enough to the doctors if you need it. And also you have the comfortability of it being that is quite nice and relaxed. You can make it your own, feel like as though you are at home. Okay, so now the cons of being in a birth center is the first one being that your midwife that's looking after you, although they aim to stay with you, may have to leave to go and see another patient either in a clinic or to see somebody get settled into their rooms, and therefore your midwife may be a little bit of a, you know, going in and out of your room quite a bit if they need to. It also just means that, you know, you may have to have another midwife pop in just to check on you to make sure you're all right, whilst your midwife that is located to you from the beginning is seeing another patient or doing something else. So that is one of the biggest cons in having your baby in the birth center. The other thing is that with the birth center, there's always not a very big chance, but there is also a chance that when you go into labor and you call them to say you're coming in, they may tell you that the place is full or they're a bit short of staff. So you may have to start your labor on the labor ward and then be asked to come back down or up or to the birth center. The other con with the birth center is that, you know, when you come in, you may be then sent back home if you're not in established labor and it's too early for them to keep you. You may be sent back home to go and wait it out a little bit. So this might be a bit uncomfortable and it might be a bit disheartening sometimes for you to be told you have to go back home. So that's one of the other cons for delivering in a birth center. If you would like to know more about choosing a birth center, then please go on to the website called which.co.uk. So that's www.which.co.uk, and you're going to look for the birthplace study. Okay, this will give you loads of statistics on giving birth in a birth center, giving birth in a home birth, or giving birth in a delivery suite. It will help you to make your decision a bit easier for you. I hope you found this information useful, and if you did, please subscribe. Please share the video as well if you feel you know anybody that this will be useful for. Also, please leave a comment if you have anything, any question to say. Let me know if you've already decided where you're going to give birth or if you're still in the process of deciding. And in all of this, please remember to discuss it with your birthing partner or with your partner to make sure that they know what you are thinking about, what's making you decide where you're going to deliver, and they feel a part of the process as well. Thank you so much for watching. Please give it a thumbs up, subscribe to the channel, and share the video with others. I'll see you in the next video where I'll be discussing about giving birth in the delivery suite, and I'll be giving the pros and the cons for doing that as well. Thank you so much. See you in the next video. Bye-bye.